outsourcing nurses outsourcing nurses is not the primary step to have been taken by the ministry. The problem in Belize is not necessarily that we do not have or enough nurses haven't passed through Belize. The problem is we have a big problem in retention of nurses. So if we continue to increase the suffrage of nurses across the country, we will have to keep importing nurses. And whenever we do that, we lower our standards.
One can argue that position is one for further discussion. However, it does not address the current need for nurses where vacant spaces are available.
I understand that, but I will beg to differ. This is not something for further discussion. This is something that needs to be addressed today. This is something that we have been discussing for years, and the ministry keeps dragging its foot. We have quite a bit of nurses in country that do not have a job because the ministry, the government, refuses to increase the amount of available posts for nurses to be hired. That is a fact.
God forbid we step into another wave, another COVID-19 wave with the shortage of nurses. Perhaps it is that the Minister of Health is already considering a contingency plan by bringing in foreign nurses to fill that gap in the event that the country faces another COVID crisis. How can you not support such a contingency plan?
By the comments of the minister, first of all, that is not the purpose to resolve in his contingency plan. A nurse just posted on one of her chats this morning. They are basically saying, you know what? We don't care. If you guys want to leave, you can leave. We have people to substitute for you. And that is the sentiment of the nurse.